You are now tuned in to the Dads Who Lift podcast, episode 3, with your host, Joel Staley. Today I'm talking to Nick Kucera of NextGen Male Medical of Omaha, Nebraska. What's going on, Nick?
Not much. Thanks for having me.
Yeah, my pleasure. So today I'm going to ask you some questions about TRT, which is testosterone replacement therapy.
Yep.
Nick just dropped a bomb on me that my T levels came back pretty low, so that's pretty insane. But this is one of those subjects that a lot of people have questions about. There's a lot of misconceptions out there, so I'm looking forward to picking your brain. Do you want to tell us a little bit about yourself and how you got into the field?
Yeah, again, my name's Nick Kucera. I'm one of the owners of NextGen Male Medical Clinic. Basically, I went to like 5 different TRT clinics here in Omaha. Just didn't get the results I was looking for. Couldn't get the right answers I wanted. Kind of kept getting the runaround, so I started doing a lot of research and talked to my business partner about opening one up, and I guess the rest is history. Here we are.
Awesome. So what's something that separates you guys from the competitors in Omaha?
Kind of what I kind of talked to you about earlier, but I couldn't get some of the doctors to answer some of the questions I had. Why are my levels here? Why is my body doing this? I couldn't get the right answers, that I was looking for. Would switch to another clinic. I would say, okay, so my testosterone is high. Why is my estradiol so high? Okay, they want to give me an anastrozole, so they knock it down. Just kept getting in this vicious circle. Couldn't get my body dialed in right. So when I tell people why should they come here, it's because we're going to listen to you. We're going to listen to what you tell us. If I say, Joel, how you feeling today? I'm going to listen to you. You're going to say, hey, I feel like this. I'm still fatigued. I'm having some ED issues, whatever it may be. And then we customize your therapy to meet your needs. It's not a one size fits all, that's for sure. Not everybody gets the same dose. Not everybody takes the same medication. Everybody's body is different. You metabolize things different. So we're going to give you the attention you need. Pay attention to how you're feeling and customize your therapy for that.
Let the record show, even though he used my name, I am not experiencing any ED issues. That's kind of messed up.
That's just the one side effect that some guys have, and there's so many symptoms of low T. One of the misnomers out there is just because you have low testosterone means you have ED. That's absolutely incorrect. Most guys that come in here just have the chronic fatigue, the excess belly fat. They just have no motivation. They might have a little brain fog. ED is just one of the symptoms, and there are many more that can come with that without that. Actually,
yeah, what are some of those? What are some signs that a guy might want to make an appointment and go get checked and see what his levels are?
If you're feeling that mid-afternoon chronic fatigue every day, you're just hitting that wall. You feel like, man, I could go home and take a nap. If you have that excess belly fat, if you have brain fog, if you're not sleeping well, if your libido's in the tank, the list goes on and on. It's a domino effect. As we get older, we start to lose a percentage of our testosterone every year. And there's only a handful of natural ways to bring your testosterone up. And unfortunately, there's usually not enough of that to bring it up to a level where you're going to feel a significant result.
So what would a healthy range be for, I assume it varies by age, but say your average 30, 40-year-old male, healthy, where would he want his levels to show up at?
So that's kind of a loaded question. Like you say, everybody's totally different. We have some guys that feel good at 600. Some guys don't feel good until they get to 1,000. It just kind of depends. And like I told you, we kind of go off of how you feel. We start you out on a low dose. We kind of gradually bring you up because you didn't lose your testosterone overnight. So we don't want to spike you. We want to gradually bring that testosterone level up. So we start you out on a low dose. We kind of get you up there. If you tell me, hey, I feel great at 600, then we'll leave you at 600 if all your symptoms have gone away and you're just running like a well-oiled machine. We keep you there. If you tell me, hey, I'm still feeling a little sluggish, mid to late afternoon, whatever it is, or maybe my libido hasn't came back quite like I want it. We bump your dose up. We gradually bring you up until we get you dialed into where you're feeling the best that you can. So to give you a number, I mean, it's hard to say, 600, 1,000, 1,100. I mean, it's a hard number to throw out there without seeing some of these labs and then starting them on the therapy and communicating with them on how their bodies react to the medication.
Okay. And once somebody does get on treatment, what are some of the benefits or some of the changes they can expect to start seeing within a few weeks?
Right. So it usually takes, we tell people about 4 to 5 weeks for the medication to get into your system. Some of the benefits, that brain fog starts to lift. Maybe your libido starts to come back. You're getting your motivation back. You get a little confidence. Your anxiety levels are lower. Your stress is lower. You're sleeping better. It just kind of a domino effect. Once that gets in your system, you just start to feel better. You got motivation to go back to the gym again. So now you're losing weight. Some of that excess belly fat's starting to go away. Like I said, it's just one thing after another starts to kind of domino. And, and also, I mean, it's not a miracle potion. You don't just take it and you're all of a sudden ripped and your libido is like you're 18 again. It does take, diet and exercise does get you the best results, but most of our guys don't exercise that come in here.
Okay. And is this something just for somebody in their 40s and 50s to consider, or?
No, we have a lot of early 20-year-olds, mid to late 20s coming in. Some of them have maybe dabbled in the pro hormones that you get from some of the nutrition stores around. Kind of messed up their natural testosterone. So we're seeing a lot more younger patients come in. And it could be, a lot of the things we put in our food nowadays. There's a lot of preservatives out there. There's a lot of artificial things that we're putting in our food. In my opinion, and that's not a medical thing, but that's one of the things I see, that the things we put in our body are a direct result in that testosterone level.
Right. So I've always heard that if you get on testosterone, you should expect to be on TRT for the rest of your life, because once you get on it, you're naturally producing testosterone stops, and then that way when you get off it, it just plummets. Is there any truth to that, or?
No, not if you're doing it correctly. We give a medication called HCG, and what that does is it tells your body to keep producing as much natural testosterone as it can. So if you're producing 303, we don't want to shut that down. We want to maintain what you are producing. And if you decide to get off of it, you go back to producing the same amount you were the day you started.
Oh, cool. So, wow, that's pretty awesome. Because that's, I know, one big deterrent of why guys don't want to get on it, because, again, who wants to commit to something for the rest of their life? If you're listening to this, honey, I'm not talking about you, but medication's getting shots every week. But you're saying that because of the way you guys do it, once you get off, you just go back to how you naturally are.
Yeah, and there's some places that they're either not specialized in this or they don't give the HCG. So that's where that common misconception comes out there. That HCG, all we're doing is supplement your natural testosterone. The HCG keeps you producing as much natural as you can. If you get off of it in a week, 2 weeks, 2 years, 10 years, you go back to producing that same amount.
Cool. And this is something insurance typically covers for the most part, or sometimes? Yeah,
a lot of some of the insurance companies will go off of a level. If you're under the 300, insurance will cover it. If you're above it, they won't. Every insurance is different. They're kind of they kind of give you the runaround on a lot of different things. But yeah, most insurance cover it. Some don't, but that's and then a lot of it is based on what your levels are at. You have to submit that to the insurance company to get it covered.
Okay. Are there any ways that you know of that guys can go about naturally increasing their testosterone without getting treatment, whether it be like diet or exercise or anything like that?
So you can, not to get a significant result, probably not, but diet and exercise are the number one. Sleep is probably right there behind it, because when we sleep, we replenish that testosterone. I'm 41. I don't know anybody that gets enough sleep. If you have kids or whatever. I have kids, so my sleep, if I get 5 hours a night, that's pretty good for me. Basically those three things are, if you exercise, and diet and sleep are the only ones that can really naturally get that back. Some people say eat a ton of protein. It's not, you're not going to go from 300 to 600 just from doing those 3 or 4 things.
Okay. Now, how can people go about learning more about TRT, and also say they do want to get checked? What's be their first step?
Well, you can look us up online at nextgenmmc.com. Go in there. We have all the information you're going to need. We have all the services that we have. You can also call us at 402-614-9700. Come in, get your labs checked. I mean, even if you don't feel like you have low T, I mean, most of us, just feel like that's how we're supposed to feel because we're getting older. That's not the case. Come in, get your labs drawn, find out where your levels are at. Then we kind of go from there. We'll customize your therapy to meet your needs.
Awesome. Nick, that's all I got for you, man. I appreciate you making the time to get on this podcast. I know you're busy.
Yeah, absolutely. I appreciate you having me.
All right, brother. Have a good rest of your day.
You too. Take care.